Hello, I'm Dr. Emily Fondren, and with me today is Dr. Brandy Brown. We are clinical faculty at Baylor University. We would like to thank Wisconsin League for Nursing for this opportunity to share with you an intervention we found beneficial for our pre-licensure nursing students. At Baylor University, we have an online BSN program that is accelerated for students who have had a previous bachelor's degree. This program is fully online with 2 immersive experiences in Dallas, Texas. We partner with healthcare organizations across Texas to provide excellent clinical experiences using both precepted and 1 to 10 models. This case study is titled Educational Panel Discussion in a Synchronous Live Session Using Zoom Technology. This case study occurred beginning in 2023 and has been a successful way for our nursing students to learn about the diverse community health nursing roles through a panel discussion. According to Adamski, interactions between RNs and students that occur outside the clinical environment can provide a learning opportunity that may not be possible in the clinical setting.
I would like to give you some background information as it relates to why the intervention was chosen for our students. Our online accelerated BSN students are located across the state of Texas. We found that due to limited placement opportunities and university policies, our students were not experiencing sufficient clinical experiences in home health, hospice, and school nursing. Our students voiced frustration because they desired to learn more about these areas of nursing. From the academic perspective, our community health faculty understood that most nurses, no matter what setting they work in, will collaborate with community health settings. We feel it is important for students to have insight into the many different roles of the community health nurse to help give insight into their impact of care transition. Online strategies must be carefully selected to build the inquisitive mind of our students. Their participation in learning is important. When researching the literature on strategies, nursing panels were identified. There is a gap in recent literature on the use of panels, but Kundrich and Melankovich describes the benefit of using panel discussions to build relationships between the students and practicing nurses.
The community health faculty chose to use an online synchronous nurse panel as an intervention to address a lack of home health, hospice, and school nursing experiences. The session was held during a 90-minute class via Zoom. Faculty developed questions to facilitate discussion, and students were encouraged to engage. Panelists were introduced, and each one shared about their role and responsibilities. They were also asked to describe a typical day in the life. The floor was then open for discussion, and students were encouraged to ask questions based on their goals of learning for the day. Questions that the student asked included, what do you do if you have a hospice patient that is a full code? What do you do if a hospice patient wants to go to the ER? How do you handle abuse with children at your school? And how do you take care of a patient who is non-compliant in the home setting? Dialogue between students and panel members was rich, as panel members shared stories about various job experiences and responsibilities. Students asked many questions and demonstrated interest in the different settings and roles of the nurse in the community. The strategy has been outlined in Kundrich and Melankovich as they share that panel discussions in community health courses can be used to foster a spirit of inquiry, developing a greater understanding and respect for community nursing.
On course evaluations, students indicate the panel discussions are helpful, interesting, educational, and some list the panel as the most valuable aspect of the course. The faculty identified significant student connection to the community health content during the session. It is important to employ activities that help the students connect with nurses to build a sense of belonging. These connections can help the students feel more confident in collaboration with other healthcare roles when they are in the clinical setting as a student nurse and into their nursing career. Future recommendation includes continued development of panel questions using Kundrich and Melankovitch question and evaluation examples. These questions have been developed to help promote critical thinking. Also, there's a public health intervention wheel question process described in Anderson et al. That can be used to develop questions throughout the panel discussion.
We thank you for allowing us to share our case study with you and hope that this information can inform your decisions on exploring strategies to promote your students' critical thinking, understanding of diverse roles in nursing, and increase confidence in their ability to collaborate in clinical practice.